Why is progress in behavior therapy so nonlinear? In my last video, I talked about the differences in how we measure progress in behavior therapy dealing with behavior concerns versus in what we tend to think of more as dog training, operant conditioning, and why it matters. In this video, I want to talk a bit more specifically about the factors influencing behavior therapy and why that progress is so nonlinear. Just to lay down a couple of foundational understandings before we jump into this conversation. Dog training, as we tend to think of it, is operant conditioning. We're teaching the dog to sit, stay, walk on a loose leash, spin in a circle. We might see operant conditioning be the primary operating lens in things like teaching manners, service dog work, trick training, sports, but it is not the main lens we use in behavior therapy. Behavior therapy is dog training for behavior concerns. I specifically work with dogs who are dysregulated, so their nervous system is set to a higher stress level baseline than is ideal, and they often struggle with resilience to stress and the ability to self-regulate. Not all dogs with behavior concerns are dysregulated, although most dysregulated dogs will have behavior concerns. So I am going to talk through the lens of what I do, which is to work with dysregulated dogs. Behavior therapy is ironically not very focused on teaching new behaviors. And that's because the behaviors are a symptom of what is actually going on, which is unhealthy levels of stress. And that often goes back to things like anxiety disorders, trauma, hyper or hypoarousal, or chronic stress. And these labels can be rooted in things like genetics, early environment, which yes includes the socialization period, but also means like in utero, before maternal care before the socialization period even begins. Certainly learning history plays a role. And so there are a lot of factors that go into the sort of end result that we see, the symptoms, the behavior that are symptoms of these underlying issues. And so in behavior therapy, we're not focused on changing the behavior because that's very superficial. That's not going to be long lasting, and at worst, it can be really unsafe. But if we go deeper down and we work to reduce the baseline stress levels, we work to reduce the intensity of the stress response to specific triggers. We work to improve resilience to stress. We work to improve the ability to self-regulate. Then we're going to see shifts in those behaviors, those presenting concerns. So we can see right off the bat that this is already a bit more complex than teaching a dog who is already in a good learning brain, already has healthy levels of stress hormones to perform a behavior for reinforcement. This is messier. This has many more factors playing into it. And that is one of the big reasons, that's sort of the umbrella reason, that behavior work is nonlinear. Now, we should ideally be trending upward overall, or we should be troubleshooting why that's not happening. So this isn't to say that behavior therapy should, I'm not saying things should get worse before they get better. I'm not saying that if you are consistently at a plateau or not seeing progress, that we should just shrug our shoulders and say that's behavior therapy. None of that is true. That's not what I'm saying. But what I'm saying is you might start to see some improvement, and then you might have a little plateau and then some improvement, and then you might feel like you have like this big regression, but then you come back up and things are good again. So what is driving these ups and downs as we're hopefully, big picture trending in a positive direction? There are actually a ton of factors. So a big one is how the dog feels in their body, especially if we're dealing with chronic pain or chronic illness. When the dog is struggling because they don't feel good in their body, we might see what looks like a regression. And what's actually happening is that they just have a smaller window of tolerance for that stress. And so you might see that your dog has been doing really well, and then allergy season hits and we see a bit of a regression. Or they tear their CCL and we see a bit of a regression. Related to physical health, We can also see perhaps your dog gets a poor night of sleep the night before. Maybe you guys are out late with a good activity, but you wake up at the same time. Or maybe there were people visiting, and maybe your dog loves when visitors come, but they were definitely struggling to get as much sleep and as high of quality of sleep as they normally have. And we might see that not getting that sleep that they normally do at the same quality and quantity impacts their behavior the next day, same as with us humans. Maybe those visitors were stressful for the dog, but we're able to manage it. We're able to keep their stress levels low enough and keep everyone safe. But there is still going to be some fallout from that. We're going to see that the dog is a bit trigger stacked. And so in the days that follow that visit, we might see that the dog needs additional support. They have a smaller window of tolerance. Maybe they need additional management. And there might be other sort of no choice moments, vet visits. Maybe we're moving across the country. Maybe we add a new pet to the house or a baby to the home. Maybe our work schedule changes. Maybe we're sick and that disrupts their routine. This is part of the reason that resilience is such a big part of what we work on, because life is going to happen. Stressors are going to happen. Can we reduce the amount of time it takes our learner to bounce back from those stress events? But certainly, we're balancing everyone's needs in behavior therapy, and it simply may not be possible to say, I'm going to, postpone this move across the country until my dog is doing better with change. And we may have a dog who's always going to struggle with a big change like that. But can we reduce the impact of the stress? Can we reduce the level of the stress? Can we increase the recovery time? Can we empower the dog with the ability to regulate themselves? Can we empower the human in a way to help them co-regulate with their dog? Absolutely. But so we might see during that time, as the dog is adjusting to the new house, we might see a bit of a shift back. Maybe there are new triggers in the environment, or maybe the opposite direction. Maybe the environment is actually a lot less triggering, and things actually are better than before once we get through that transition. Sometimes there are management failures, and that can set us back a bit, not to square one, because we retain everything that we've learned up to that point, and we have been working on increasing resilience. But maybe there's an off-leash dog that runs up to us. Maybe a fight happens. Maybe a door gets left open. And so management may break down. Our dog has a negative experience, and that can certainly influence. We need to take time and care in helping the dog to feel safe again. And that can certainly influence where we are in the presentation of the behavior. There may be sudden stressors that we're unprepared for in the environment. We're seeing that with storms a lot where I am this year. The storms are now tropical in nature, which is new, and so they're really intense, and they are increasingly difficult to predict, and they are really loud, and so it's been harder to have management for my local clients around those storms. And so that's another example of that management breakdown, but with a slightly different twist, and that can impact things. Even things like hormonal shifts, developmental periods. Maybe we're working on dysregulation that we're seeing in early puppyhood, and then adolescence hits. Well, in adolescence, the thinking brain literally shrinks. Stress hormones rise just for fun, not even because the dog is dysregulated, just for fun. And we see difficulty with thoughtful decisions. We see things like reactivity and resource guarding surface. And so certainly if we have a dog who's already struggling with dysregulation, who's already developing atypically, adolescence plays a huge role. And what's after adolescence? Social maturity. And so these factors can play a big role. I always tell my intra-household clients this is a huge factor that we talk about, because if you have dogs fighting in the house, we're going to see changes through these developmental periods, particularly adolescence and social maturity. And so we're really in it for the long haul, because we're going to need to adapt to and respond to these changes that we're seeing hormonally, developmentally. And so To wrap that all up, behavior is complex and it is influenced always by more than one factor, and it is often just the symptom of what we're really trying to get at. And so, for all of these reasons and more, progress in behavior therapy is nonlinear compared to something that maybe is being influenced by less factors for a dog that's already well in their learning brain and has more of a predictable path to it. Understanding this helps set us up for success.